I'm Dr. Anthony Colon. I'm a board-certified psychiatrist. So a lot of times as a psychiatrist, I deal with treating racing thoughts and I deal with anxiety. And I usually treat it with a combination of medications and therapy. And typically when it comes into the realm of a psychiatrist, it's because it's negatively impacting one's life. Example, the racing thoughts impacts their ability to have good relationships with others. Maybe it impacts their ability to concentrate in school or their functioning at work. Not all the times if one is having racing thoughts or a lot of worries, do they need to see a trained professional like a psychiatrist or psychologist. Even sometimes if it's just mild, like if there's just a little bit that's impacting one's life, we can recommend that they can check with a pastor or a rabbi or someone in the religious circle they can talk to about these things. They don't necessarily need to see a mental health professional. Only, as I said, when it impacts their functioning in life, that's when it really needs to see a professional. Joel Osteen is this famous pastor based out of Texas who has many books out there, has many sermons, and he talks about overcoming thoughts. And so I wanted to take a look at this sermon that he gives or this lesson and see if there's any psychiatric truths in there or if there's anything that's not true that should be addressed a little bit more scientifically or with medicine.
You may overhear some negative words, overhear negative reports, but you have to learn to ignore them.
Learning to ignore negative reports or negative words, especially from those that you spend a lot of time with or those are close to you, is actually incredibly important for good mental health. The relationships one has can play an important role how people think and feel. So if you're around a lot of negativity or people share a lot of dark things, then that may make you to think a lot of dark things or have those dark emotions as well.
You're not denying the problem. You're not acting like it doesn't exist, but you're not letting it take root. You can't have faith if there's doubt and fear and worried about this medical report. And Joel, the experts say it's not going to work out. Sometimes, take this in the right sense, you have to turn your mind off. Lean not to your own understanding. Yes, use common sense, but there are things we face where there is no solution in the natural. If you try to figure it out, you're going to get confused, discouraged, talk yourself out of it.
So I think he brings great points about turning the mind off or just trying to stop the racing thoughts or the thinking. And sometimes that's really difficult, especially if one is very emotional or prone to anxiety. They tend to sort of gravitate to this anxiety thinking. And so if it's very difficult to redirect the thoughts or to not overthink, that's when it could be important to have medications or therapy to help someone to redirect the thoughts.
You can't stop that you heard it, but take the next step and ignore it. Don't dwell on it. Jesus went in and prayed for the little girl, and she came back to life. A great miracle. There may be things in your life right now that look dead. Every circumstance says it's too late. You're never going to get well. Never accomplish your dream.
I don't know of many physicians or doctors that will tell a patient they will never get well. I think one of the important roles of a physician or someone that is providing healthcare is to always give the client or the patient a sense of hope to get better.
Never see your family restored, but God has the final say. When you believe, all things are possible. Don't give those negative seeds any room in your soil. When you're in a battle, when you're up against those giants, you need your heart filled with hope, with faith, knowing that God is bigger, knowing that He's fighting your battles, that He's making ways where you don't see a way. See, the messenger said it was too late, but they were wrong. The little girl was healed. Saul said, David, you're just a boy. You can't defeat Goliath. But Saul was wrong. David won. Those two ladies said that I couldn't minister, but they were wrong. Here I am. The experts told my mother that she had terminal cancer, a few weeks to live, but they were wrong. 42 years later, she's still alive.
I would be shocked if a doctor suggests that someone has terminal cancer and they live for 42 more years. Granted, nowadays there's a lot better medications, especially in oncology. There's billions of dollars a year spent just on cancer medications. And so the treatments we have are much better. But typically if someone has terminal cancer and the doctors actually find out they have terminal cancer, the odds are that's the case. Nowadays, it's very unlikely that someone is going to live that much longer in a case of terminal cancers. Not to say that's not impossible, but I really question the authenticity of that message.
People told us that we would never get the Compaq Center, that the city would never let a church have it, but they were wrong. Here's my point. In each of these situations, if the people would have let the negative seeds take root, then what the others were saying would have been true. David wouldn't have defeated Goliath. Jairus' daughter would have died. My mother wouldn't have been healed. I wouldn't have become a minister. The determining factor wasn't what other people said, it's whether we let it take root. We control what we allow in our soil. I'm asking you to refuse the negative seeds. Refuse the doubt.
So it's such an important tool actually to refuse the negative or try to twist it or transform it into something positive. There's a whole movement on positive psychology where having like a positive, seeing the silver lining and even the adverse circumstances is an important role in good mental health.
Refuse the fear. Refuse limitations that people put on you. My grandmother on my father's side of the family was a very feisty woman. She only stood 4 feet 11 inches tall, but she would fight a tiger. She lived out in the country her whole life. If you've ever seen the Beverly Hillbillies, she was Granny. Her name was Ellie Mae. She chewed tobacco. She dipped snuff. I come from a very sophisticated family. I'm so glad my sister Lisa finally quit, but when my grandmother was up there in years, she went to the doctor for a checkup, and he said, Ms. Osteen, I'm sorry to tell you this, but you have the beginning stages of Parkinson's disease. Well, my grandmother didn't know what Parkinson's was, but she knew she didn't want to have anything to do with it. She got up off the table, bristled back, and said, listen here, sir, I do not have Parkinson's disease. I refuse to have it, and besides, I'm too old to have it. He looked at her like she was a little bit crazy, and she was. But do you know, my grandmother never did have Parkinson's disease. If she had it,
Parkinson's disease is kind of it can be misdiagnosed, but if someone has Parkinson's disease, it's actually chemical changes in the body, lack of dopamine in parts of the brain that can manifest as someone getting tremors. It can affect their gait. It really affects a lot of their muscles. They can get more prone to depression because of it. So I think it's important here, the principle or the point that he's making is don't be too identified with the disease or illness. And that part is true because we're much more than what sickness or illness or disease someone has. Human beings have so much more to their life. And I think sometimes when someone gets diagnosed with something, they can focus too much on that diagnosis or identify too much with that sickness or illness, and it's part of their identity. But just it's important to know that people are much more than that.
the symptoms never showed up. Now, I know you can't wish things away, but something happens when you don't let the seed take root. I'm not saying bury your head in the sand, deny reality. I'm saying don't let it get down in your spirit where it becomes your default setting. You're always thinking, I have this disease, I'm limited. No, your body is a temple of the Most High God. See any sickness, any addiction, any pain as foreign. You don't belong here. You are not welcome. I am God's property. See, doctors tell us what medical science says, and they give us diagnosis based on skill and expertise and training, and they help us to get well, but at times they come to limitations. There's nothing more they can do medically speaking.
So that part is true. Science can only do so much, and a lot of it has to do with faith and belief and trust in a higher power like God. In fact, if you even look at the data with the placebo effect, just a sugar pill in itself, or a pill that has no medicinal properties, if someone believes it's going to work, it's going to have a lot of health and healing. If someone believes it's going to be harmful, it's going to be harmful. So faith and trust is such an important role even in scientific medicine.
While we respect the diagnosis, that's one report, but there's another report from the God who created you, from the God who made you in His own image, from the God who knew you before you were formed in your mother's womb. He's called Jehovah Rapha, the Lord your healer. Isaiah said, who will believe the report of the Lord? In life, we have different reports. Here's the medical report. Here's my financial report. And here's what King Saul says. And here's what those two those two ladies said. No, we get to choose which report we're going to believe. He'll never be as good as his father. That's one report, but there's another one. I can do all things through Christ. I am strong in the Lord. God being for me is more than the world being against me. Why don't you choose the report of the Lord? You're not going to get well. That sickness is permanent. Learn to live with it. There's another report. God is restoring health back into me. I will live and not die. With long life, God will satisfy me. Well, you'll always struggle. You'll always have lack, not enough. How about this report? I will lend and not borrow.
Again, I don't know of many medical professionals that will tell people or tell their patients that they'll always struggle. There's always the sense of hope that you want to provide or give to people, because amazing things can happen. Things that science hasn't proven can happen.
My cup runs over. I live under the open windows of heaven, blessings that I cannot contain. What seeds are you letting take root? What you're dwelling on is what's going to come to pass.
He makes great points about what you dwell on and what you focus on, because even in mental health, we know that if you dwell on more depressing or sad thoughts, that's going to lead to more depressing and sad emotions. If you dwell on more anxiety thoughts, that's going to lead to more anxiety feelings. And again, if it's hard to not dwell on these, then that's where medications can really help, because it can help calm the mind down so that people have more control or more ability to change what they're thinking and change their perception of what's going on.
I talked to a woman that was pregnant with triplets, and because of some other complications, it was considered a very high-risk pregnancy. They sent her to a group of doctors that specialized in this. She was told that she would be bedridden after 3 months of pregnancy, and that the babies would be born at least 4 months prematurely. They'd seen this happen again and again. And she was respectful, but she didn't let that seed take root. She told the doctors that she was going to be the exception, that her babies were going to be born full term, and she was not going to be bedridden. They looked at her like, yeah, right. At one point, the main doctor said, you're going to get gestational diabetes, something that occurs during pregnancy that can lead to long-term diabetes. He said, it's not if you get it, it's when you get it. You have all the signs. It's just a matter of time.
Again, I don't know of physicians that put 100% certainty in all these, what he's saying. There's always exceptions, and I think part of the role as a physician is to educate the patient that this is a possibility or this is a likelihood, and then the patient can deal with that information as they wish. And yes, maybe they hope they're the exception that doesn't deal with these problems. But I don't know of really many physicians or clinicians that will say for certain they will get these things.
She asked the doctor very politely to not pronounce things over her that have not yet happened. She said, I'd prefer you to say, the statistics indicate that you will get gestational diabetes. She didn't want that defeat being spoken over her. You can't always keep it from coming, but you don't have to let it take root. They thought she was kind of odd, but do you know she carried the triplets the full 9 months? She was never bedridden. She drove herself to the hospital to deliver, and she never did get gestational diabetes. Now these same doctors call her the miracle mom. They said, we've never seen anyone like you. It's amazing what God will do if you don't let negative seeds take root. Whose report are you going to believe? The report of the Lord or the report of people?